Hi everyone, let's talk about the attachments in terms of muscles of mandible. Starting off, first of all, talking about the oblique line. Now, recall all information. Where's the oblique line? On the outer surface or inner surface? The outer surface. On the inner surface, you had the mylohyoid line. Now, when you talk about the oblique line, so this is the outer surface, it's also called the lateral surface because laterally it is situated, right? Outer. And interiorly, you have the medial surface. That's the inner surface. Now, on the lateral surface, you have the oblique line. Now, in the oblique line, it gives origin to the buccinator muscle, very important. Which muscle? Buccinator muscle. And it goes as far towards the anterior border of the first molar tooth. So this is the first molar tooth, so it goes up till that. So this is the origin of the buccinator muscle. Then, just in front, like towards the end of the oblique line, you have depressor labii inferioris. So the oblique line is super important. You have depressor labii inferioris, and then just below that you have depressor anguli oris. So super important. Remember, oblique line situated on the outer surface. It gives origin to buccinator, depressor labii inferioris, and depressor anguli oris. Buccinator, depressor labii inferioris, depressor anguli oris. So this is the oblique line. Then you have the incisor fossa, which gives origin to the mentalis and the mental slips of orbicularis oris. You can already locate that, but let me clear what is incisive fossa. I already left this question for you in the previous video. Incisive fossa and alveolar sockets. Now, alveolar sockets are basically exactly if you remove this teeth and you see this is not a teeth, this is a tooth because it's a molar. If you remove this tooth or even this teeth, so you'll notice that there is a hollow depression inside. So that's the alveolar socket. Now, what is incisive fossa? I've attached this photo. Now, here you can see this is mentire symphysis. I already told you in the previous video. And then this is the triangle surface, which forms exactly in the median region. That's mental protuberance. Right beside that, you had the, see right here, mental tubercle. Now, when you look at this symphysis menti, you'll notice that here you have incisive fossa, right here. So in this diagram, where is it? If this is symphysis menti, so right next to it you have incisive fossa. There, the incisive fossa gives origin to mentalis and orbicularis oris. Orbicularis oris is that muscle. If you look at the face, you'll see there's a circular muscle around the lips. So yes, it gives origin to the mental slips of the orbicularis oris and mentalis. What is this? Incisive fossa, right? And before that, what did we discuss? We discussed the oblique line, which gives origin to buccinator, depressor labii inferioris, and depressor anguli oris. Moving on. Parts of both the inner and outer surfaces just below the alveolar margin, they are covered by the mucous membrane of the mouth. So I'm telling you here that this is the alveolar margin, right? Or you call it the upper margin. So this is covered by mucous membrane on both the outer and the inner surface. It's covered by membrane. Why? You'll notice here you have the gums. So very important for you to know. So you can touch your gums both in the interior and outer region. Then after that, mylohyoid line. Where is the mylohyoid line? On the inner surface. Now it has again its own significance. It gives origin to the mylohyoid muscle. And when you talk about mylohyoid line and mylohyoid muscle, so just on the posterior surface, if you go superiorly, you'll see another muscle. It gives origin to superior constrictor muscle. Superior constrictor muscle is the muscle of the pharynx. So it arises just above the posterior end of the mylohyoid muscle. And then right in front of that, you have uh, attachment of pterygomandibular raphe. Pterygomandibular raphe is attached immediately behind the third molar tooth in continuation with the origin of this superior constrictor. Now, what is pterygomandibular raphe? I've attached this photo from Ken Hub. Now, pterygomandibular raphe, also called pterygomandibular ligament, it's a tendinous band of buccopharyngeal fascia. It extends from humulus of the medial pterygoid plate of sphenoid to the mylohyoid line of the mandible. So see mylohyoid line. So from sphenoid to mandible, it extends. So it's basically a tendinous band of buccopharyngeal fascia. Here, when you open your mouth, you'll see right here, that's the pterygomandibular raphe. or you can call it pterygomandibular ligament, which is a tendinous band of buccopharyngeal fascia. It extends from the sphenoid to the mandible. Buccinator muscle attaches to the interior margin of the pterygomandibular raphe, while the superior pharyngeal constrictor muscle attaches to its posterior border. Medial surface is covered by the oral mucosa. Adipose tissue separates its lateral surface from the ramus of the mandible. So laterally you have adipose tissue that separates it from the ramus of the mandible. But anteriorly you will see that it has, did I like say something wrong? Laterally you have the adipose tissue that separates it, right? And medially you have the oral mucosa. And yeah, so here they told you that interior margin has buccinator muscle and posterior margin has superior constrictor muscle. So let's have a look. We did talk about the superior constrictor muscle already, and they're saying interiorly it gives origin to the buccinator muscle. So yep, they're absolutely right. That's the buccinator muscle anteriorly. Now, when you talk about the other things, you have the tubercles, very important. Mental tubercles, also known as genial tubercles. In the previous video, I told you they give origin to genioglossus. I made an error there because I already clarified that there are four of them, right? So, superior to, they give origin to genioglossus, which is the muscle of the tongue. And the lower two, the inferior two, they give origin to geniohyoid. So let me clear that here. Genioglossus and geniohyoid. How do you remember that? G. G comes first, right? In alphabetical order, A, B, C, D, E, F, G, and then H. So superior for genioglossus, inferior for geniohyoid. Clear. So is it origin or insertion? It's origin. So far we've just covered the origins. Then, very important, the oval depression that gives origin to digastric muscle, the interior belly, and this is very obvious because this is called digastric fossa. Then, deep cervical fascia, investing layer, is attached to the whole length of the lower border. So, the entire lower border, it basically attaches to the deep cervical fascia. Then platysma is also inserted into the lower border. If you talk about platysma, this is platysma, outer surface. It's attached to the lower border. So now we started with our first insertion. So this is our first insertion. Insertions are in blue. Here you can't see it very clearly, but yeah, insertions are in blue and origins are in red. Then very important, masseter muscle. Entire length of ramus, it is occupied by the insertion of masseter. Very important. And posterior superior part of the lateral surface is covered by the parotid gland. Lateral surface, this is the lateral outer surface. Posterior superior condylar region. So right, like laterally to it is the parotid gland. So here, and then comes the ramus. Sphenomandibular ligament is attached to the lingula. Now lingula is inside, right? So lingula is at the anterior surface of the mandibular foramen. There you have the sphenomandibular ligament, obvious. Medial pterygoid muscle, very important. It's situated at the angle, right here on the inner surface. Then you have the temporalis. So if here is the medial pterygoid, here will be the temporalis on the antero superior part of the ramus. And where is the lateral pterygoid? On the neck of the condylar region. So here, let me just make it clear. Lateral pterygoid, medial pterygoid, temporalis, and masseter. These are the muscles of mastication. So you know now the insertion. So these all are inserted here. One is masseter, one is medial pterygoid, one is temporalis, one is lateral pterygoid. So these are the insertions. Then you have the lateral ligament of temporomandibular joint, which is also attached to the neck, which is the lateral ligament of the TMJ joint. We'll talk about it later when we're covering TMJ joint. Now, what are the nerves and vessels? Very important. First of all, the mental foramen, let's locate it. It's here. This is the mentalis muscle in incisor fossa. Don't forget that. Don't confuse the two. Now, mental foramen, it has mental nerve and vessels, arteries and veins both. Then you have the inferior alveolar nerve and vessels which enter the mandibular canal and they enter through the mandibular foramen. So this is the mandibular foramen and in it go into the mandibular canal, inferior alveolar artery and nerve. Then you have the mylohyoid nerve which lies in the mylohyoid groove. Where is the mylohyoid groove? Here. So you have mylohyoid groove, like there you have the nerve and the artery both. So mylohyoid nerve and artery, then you have inferior alveolar nerve and artery, and then you have the mental nerve and artery. Then the lingual nerve, it's here, right here, and it's only the nerve. There's no artery that accompanies it. Just the nerve related to the medial surface of the ramus. Medial surface of the ramus in front of the mylohyoid groove. This is the mylohyoid groove, so in front of that. And sorry, mylohyoid line, right? It should be in front of the mylohyoid. Okay, you can say this is the groove, right? So in front of groove and line both. You have the lingual nerve, which is alone. Then the mesenteric nerve. It's very important. It will be here on the mandibular notch. So mesenteric nerve and vessels both. Then you have the auriculotemporal nerve, which is auriculotemporal nerve is here, and superficial temporal artery. So auriculotemporal nerve is accompanied by superficial temporal artery. Superficial temporal artery is a branch of the external carotid artery. External carotid artery gives two branches here. Here you can see actually it has a lot more branches. One is superficial temporal superficial temporal artery, and the other is the maxillary artery. And then you have very important facial arteries on the outer surface right here. If you feel just below the angle, just like touch deep in. So mandibular artery originates inside and then it winds around the mandible, so you can actually feel it pulsating, right? Now here we've covered all the arteries and nerves and veins, basically like vessels and nerves. So only you have facial vessel, which is not accompanied by any nerve. It doesn't have a facial nerve here. And also you have one more I mentioned, lingual nerve. It doesn't have an artery or vein with it. And then also there's one more, maxillary artery. Yes, it isn't accompanied by any vein, any nerve. Rest all are accompanied by their counterparts. So mental nerve and vessels. Then you had the mylohyoid nerve and vessels. Then you had the inferior alveolar nerve and vessels. Then you had the lingual nerve. You had the maxillary artery. You had the facial vessels. And then you have the superficial temporal nerve and the auriculotemporal. Uh, Superficial temporal artery and the auriculotemporal nerve, sorry, and the mesenteric nerve and vessels. Very important. Now, if we talk about the changes in mandible, in infants and in adults and old age, in infants, the two halves of the mandible, these two halves, the ramus and the body, they fuse during the first year of life. So, during the first year of life, they fuse. Then, at birth, the mental foramen opens below the sockets for the two deciduous molar teeth near the lower border. So, the mental foramen right here, at birth, it's very close by right here. That's because the bone is made up only of the alveolar part with teeth sockets. And the mandibular canal, right here, you can see the mandibular canal. It runs very close to the lower border. This is the lower border. So basically, it terminates here. The mandible for babies terminates here because it's only the alveolar region is developed. With time, the foramen, this canal, it gradually shifts upwards because this region also forms. And the angle is obtuse. In babies, this is a very wide angle, like this, obtuse, 140-degree. In adults, this angle, it comes to lie at not 90 exactly, but around 110 and 120 degrees. And also the mental foramen, it opens midway here and not very close by here, like in babies. This was in infants. So this is in adults in midway. And then also, yeah, that's pretty much it. The mandibular canal, it's also much upwards. And in babies, it was very close to the lower border. In old age, the teeth fall out from here. Why? Because all of these sockets, they vanish, and this is much of a straight line. The alveolar border is a straight line. And mental foramen and the mandibular canal, they're very close to the lower border again because the mandible, it shortens. And again, the angle is obtuse, 140-degree. Now let's talk about the structures related to mandible. You have salivary glands, parotid, submandibular, and sublingual glands, right? Here is the sublingual, submandibular, and parotid. I already told you here, parotid. And then you have lymph nodes, parotid, submandibular, and submental lymph nodes. Vessels and arteries are all of the vessels and arteries mentioned here. I've already mentioned them. You can revise. Maxillary, superficial temporal, mesenteric, inferior alveolar, mylohyoid, mental and facial arteries, lingual, auriculotemporal, mesenteric, inferior alveolar, mylohyoid, and mental nerves. Muscles of mastication are temporalis, lateral pterygoid, medial pterygoid, and mesenteric muscle. Ligaments are lateral ligament of temporomandibular joint, stylomandibular ligaments, phenomandibular ligament, and pteromandibular uh, ligament or raphe, right? Raphe, I've already told you. So these are all the ligaments of the TMJ joint. And then the clinical anatomy is that mandible is very commonly fractured at the region where you find canine. So if this is a canine, I think this is a canine, right? So here it's very common for it to fracture. Other than that, it can also fracture at the neck region, or it can also fracture at this angle region, right? Because these areas are weak. If it fractures, sometimes inferior alveolar nerve is also damaged in it, so that can cause neuralgic pain, which may be referred to the areas of distribution of buccal and auriculotemporal nerves. If that nerve is completely paralyzed, then this area will be made insensitive. And yeah, angle, neck, for now, know that, and canine region, this is the common areas of fracture. So we have covered mandible. Thank you so much.